Hyperemesis gravidarum. Hyperemesis gravidarum is the medical term for severe nausea and vomiting during pregnancy. The symptoms can be very uncomfortable. You might vomit more than 3 times a day, become dehydrated, feel constantly dizzy and lightheaded, and even lose weight. Fortunately, there are treatments available, including medicines, to prevent nausea. Hyperemesis gravidarum is a disorder of early pregnancy that is characterized by severe nausea and vomiting. Hyperemesis occur in 5 to 10 cases per thousand pregnancy. The disorder most often appear at 8 to 12 weeks gestation and it usually resolves by 16th week. Let's see the definition of hyperemesis gravidarum. It is a severe type of vomiting during pregnancy which has got a deleterious effect on the health of the mother or incapacitates her in day-to-day activities. Moving on to the etiology or the causes of this hyperemesis gravidarum. Let's see some of the etiology. It is mostly limited to the first trimester, that is during the first 3 months. It is more common in first pregnancy, that is in primigravida. It has got a familial history. It is more common in hydatidiform mole and multiple pregnancy. It is also common in unplanned pregnancies. Moving on to the theories. They have formulated certain theories based on this hyperemesis gravidarum. That is, the first one is hormonal, the second one is psychogenic, the third one is dietetic deficiency, the fourth one is allergic, and the fifth one is immunological basis. So there are 5 theories which has been postulated towards this hyperemesis gravidarum. Okay, so we'll see the theories one by one. In that first one is hormonal. In hormonal, the high level of human chorionic gonadotrophy hormone, also the increased association with hydatidiform mole or multiple pregnancy when the SCG titer is very much raised. Second one is hypoestrogenism. Third one, the progesterone excess leading to relaxation of cardiac sphincter and simultaneous retention of gastric fluid due to impaired gastric motility. And the fourth one is adrenocortical insufficiency. The second theory is psychogenic. It probably aggravates the nausea once it begins, but neurogenic elements sometimes play a role as evidenced by its subsidence after shifting the patient from the home surrounding. So you can see that certain patients, once they are at home, they feel like nauseated, they vomit many of the times, and once they come into the hospital, you can see that the vomiting has subsided. So this theory has been postulated under the heading as psychogenic. You can also notice that some of the patients, they feel like nausea and vomiting in particular house, and once they go to one another house or their friend's house or to their parents house, if they get shifted during the time of pregnancy, you can see that the vomiting subsides. So it has been postulated under this heading as psychogenic. The third theory which has been said is a dietetic deficiency. Dietetic deficiency, probably due to the low carbohydrate reserves that usually happens after a night without a food. So if the patient is not taking a food at night time and without food, you can see that there may be a low carbohydrate reserve which may be leading to a morning sickness, which you can see in the early morning vomiting. And also you can see that the deficiency of vitamin B6 and vitamin B1 as well as protein may be the effect rather than the cause. Because of this vomiting, the severe hyperemesis gravidarum, you can see there is a vitamin as well as the protein deficiency can be noted as an effect which is rather than the cause for this hyperemesis gravidarum. The fourth theory which has been postulated is allergic. So the vomiting may be the reason of allergic, which is stated that it may be related to some products, secreted by the ovum. So because of this allergic reaction, the patient will be suffering with hyperemesis gravidarum. This is one more theory which has been postulated. The fifth theory is immunological basis. Here, the vomiting is probably aggravated by the neurogenic element. So, unless it is not quickly rectified, the features of dehydration and carbohydrate starvation supervene, and you can see a vicious cycle of vomiting appears. So, what is this vicious cycle? It is nothing but a chain of events in which the response to one difficulty creates a new problem that aggravates the original difficulty. So, that vicious cycle can be noted here, where you can see that the vomiting lead to carbohydrate starvation, the carbohydrate starvation leads to ketoacidosis and again vomiting. So this cycle appears, and you can see the condition worsens in case of immunological basis. So that is postulated under this heading as the fifth theory. We'll see certain symptoms of this hyperemesis gravidarum. Increased vomiting, retching and nausea persist in between vomiting. The vomiters may be coffee ground or even contain blood. Decreased urine output, constipation, at times diarrhea, epigastric pain and fatigue. If the hyperemesis gravidarum is severe, you can see there is symptoms of complications which arises, that is Wernicke's encephalopathy, in which there is a mentally apathy, restlessness, sleeplessness, convulsion or even coma. Korsakoff psychosis, that is mental confusion with loss of memory or recent events. Features of peripheral neuritis, eye complications like diplopia, dimness of vision or even blindness. Moving on to the signs. So, the signs of hyperemesis gravidarum: progressive emaciation with loss of weight, anxious look, eyes are sunken, apathetic, and becoming dull. The skin is lusterless and inelastic. The tongue looks dry, becoming brown, thickly coated or red and raw. Teeth covered with sods. Breath is acetone smell. The pulse, which is rapid, 100 to 120 beats per minute. Blood pressure may be low, that is, you can see the systolic blood pressure, which measures 100 to 110 mm of mercury. The temperature may be raised to 100 degree Fahrenheit or even more. Jaundice can be seen as a late feature. Evidence of neurological manifestation, where you can see the squint, nystagmus and pulses. The nystagmus means it's a vision condition in which the eyes make a repetitive uncontrolled movement. We call it as nystagmus. You can see that the movement of the eyes, which is uncontrolled movement, which we call it as nystagmus. And also you can see that the vaginal examination to confirm the diagnosis of pregnancy. The 12th point which we have said is the evidence of neurological manifestation, that is squint, nystagmus, and it's not pulses, it is palsies. So palsies, it refers to any condition in which a single nerve or a nerve group is damaged or dysfunctional. So just make a note of it, it is a palsies. Moving on to the investigations. So we have seen about the symptoms, we have seen certain signs and also the signs which based on the complications. Moving on to the investigation, there are certain investigations which can be done during this condition. First one is urine analysis. In urine analysis, you can see that the quantity will be small, the dark colored urine, high specific gravity with acidic reaction, the presence of acetone, occasional presence of protein, and rarely the bile pigments can be seen, diminished or even absence of chloride. The other investigations which can be performed are biochemical profile, ophthalmoscopic examination and ECG. In biochemical and circulatory changes, routine and periodic estimation of the serum electrolytes, that is sodium, potassium and chloride, which is really helpful in the management of the case. Ophthalmoscopic examination is required if the patient is seriously ill. Retinal hemorrhage and detachment of retina are the most unfavorable signs which can be noticed in this condition. ECG, the patient has to take a trace of ECG when there is an abnormal serum potassium level. Diagnosis. So the pregnancy is to be confirmed first. Thereafter, all the associated causes of vomiting enumerated before are to be excluded by careful examination before pinpointing the diagnosis of hyperemesis gravidarum. In acute onset of vomiting, extra gestational causes are also to be thought of. The complications which you can see is the neurological complication, the stress ulcer in stomach and jaundice. In neurological complications, you can see the vernix encephalopathy, peripheral neuritis and Korsakoff psychosis. Moving on to the prevention. So, as we all know, the prevention is the best one. The only prevention is to impact effective management to correct simple vomiting of pregnancy. So, there are, as we have said, that the hyperemesis gravidarum has a various postulated theories, and the causes where really it is difficult to control. So, in such cases, we can only prevent the condition by by seeing that the patient vomiting is reduced. So we have to focus more on the thing that the vomiting is reduced. So here we can see that is correction of vomiting during the pregnancy is one and the foremost thing of prevention in order to moving on to a severe vomiting. So that is one thing which has to be kept in mind. Finally, we will discuss regarding the management of hyperemesis gravidarum. So, first and foremost, whatever the management of any condition, the principal concept has to be kept in mind. So, the principle in the management are to remove the neurogenic elements, to correct the fluids, electrolytes, and other metabolic disturbance promptly and effectively. The third one is to prevent or to detect at the earliest the ominous complication that may arise. So these three principles has to be kept in mind for effective management of hyperemesis gravidarum. The first and foremost thing is hospitalization. Whenever the patient has been diagnosed as a case of hyperemesis gravidarum, it is desirable to hospitalize the patient even in the early stage. Surprisingly, you can see that with the same diet and the drugs which was used at home, the patient improves rapidly. That is one of the things which is noted most of the time in hyperemesis gravidarum patient as they are hospitalized. The relatives may be too sympathetic or too indifferent. She should be cared by a competent and tactful nurse. The second thing, fluids. So here fluids, oral feeding is withheld for at least 24 hours after the cessation of vomiting. During this period, the fluid is given preferably through intravenous drip method. The drugs which is used are adequate sedation. The adequate sedation is obtained with the help of promazine or diazepam twice or thrice daily intramuscularly, because of course she is suffering with vomiting. The second one is antihistamine and antiemetic drugs such as promethazine or prochloroperazine or trifluperazine may be administered twice or thrice daily intramuscularly. Fourth one is vitamins. The vitamins are administered to prevent neuropathy and to accelerate carbohydrate metabolism. Daily intramuscular injection of vitamin B1 100 mg, vitamin B6 100 mg, vitamin C 100 mg and vitamin B complex are given. So these are the vitamins which has been included in hyperemesis gravidarum case. And hydrocortisone 100 mg is given in the drip in case of severe hypotension. So these are certain drugs which is used in hyperemesis gravidarum. Moving on to the nursing care. In nursing care, sympathetic but firm handling of the patient is essential. Care of the teeth, gums and oral hygiene has to be taken as she is severe vomiting. To maintain a hyperemesis chart, a chart is to be maintained noting the progressive record of the vital features, which includes fluid intake and output, vomiters and urine in 24 hours. It has to be charted. And character of the vomiters has to be documented. Pulse, respiration, temperature, blood pressure at least twice daily or more frequently, that is 4 hourly, can be monitored. Urine examination at least twice daily for specific gravity acetone, chloride, and once daily for protein and bile. Blood biochemistry on admission and as frequently as required if the facilities are available. Weight of the patient on admission and again when out of bed has to be checked. ECG to ascertain blood potassium status. Based on the blood potassium, the ECG has to be taken. Moving on to the diet, the foods are given orally, and if the patient can retain them, at first dry carbohydrate foods like biscuits, bread, and toast are given. The diet should be normalized quickly as the stomach is more likely to retain solids than liquids. The meals are served at frequent intervals. Gradually, full diet is restored. So, as we have discussed, the diet plays a very important role. So, the patient will be usually kept NPO for 24 hours or until her vomiting is subsided, and she will be on the IV fluids. And you can gradually starts with the foods. So, the foods are given orally if tolerated. Especially such patients are given with dry carbohydrate diet. You will get a crackers like biscuits which can be given, so that is best tolerated by such kind of patient. And later on the diet can be normalized as the stomach is more likely to retain solid food than liquid. Meals are served frequently. Gradually the patient can be switched on to the full diet. So the pattern of diet depends upon the condition of the patient. The termination of pregnancy. So here the termination of the pregnancy has to be thought of here. The following are the certain indications for therapeutic termination. So there are certain listed down indications where you have to follow. That is, the first one is a steady deterioration in spite of therapy. So whatever the fluids, the medicines, the diet which you have managed, still the patient's vomiting is not controlled. She's not able to control the vomiting. The condition of the patient is getting worse, and she's having a severe hyperemesis gravidarum. In such cases, then of course you have to move on to a decision of termination of pregnancy. So there are various listed down indications. So a steady deterioration in spite of therapy, that is the first and the foremost indication. And the second thing is a rising pulse rate of 100 beats per minute or more than that. The pulse rate is rapid and it keeps on increasing, and the rate is more than 100 and above 100. So that's the reason. And if there is a temperature which is a high degree temperature of more than 38 degrees centigrades or 100 degree 100.4 to 100.6 degree Fahrenheit, the temperature is not coming down, then you have to plan for the termination. Gradually increasing oliguria and proteinuria, appearance of jaundice, appearance of neurological complications. So these are certain things. The last two complications should not be allowed to occur when the patient is under observation. So you have to make sure that the appearance of jaundice or appearance of a neurological complications which we have discussed before, so the patient should not land up with such complications. So it becomes like Wernicke's encephalopathy, Korsakoff psychosis, peripheral neuritis, diplopia, dimness of vision, or even blindness. So that is the very worst part of this hyperemesis gravidarum. So the prompt observation and proper management during the initial stage is very essential, so that the patient will not land up with such complications. So these are the indications for termination of pregnancy. So in such cases, you cannot think twice, we have to go for a termination of pregnancy. So what are the methods of termination? So it is divided as below 12 weeks, what are the procedure you have to follow, and above 12 weeks. If it is below 12 weeks, the suction evacuation under paracervical block or so slow dilatation of the cervix by laminary attent followed by a rapid dilatation of the cervix and evacuation. This can be done in case of the pregnancy below 12 weeks. Above 12 weeks, abdominal hysterotomy, preferably under local anesthesia, can be performed. So today we have seen about the hyperemesis gravidarum, the introduction of hyperemesis gravidarum. So Hyperemesis gravidarum is a disorder of early pregnancy that is characterized by severe nausea and vomiting. We have seen the definition, the etiology. There are certain listed down theories that is based on hormonal, psychogenic, dietetic deficiency, allergic, and immunological basis. We have seen certain symptoms and certain symptoms of complications. We have seen the signs, and we have seen what are the investigation procedures which we are going to do for this hyperemesis gravidarum, that is urine analysis, biochemical and circulatory changes, ophthalmoscopic examination, and ECG. Then we have seen the diagnosis, and mainly the prevention and the management, how you can manage the patient with hyperemesis gravidarum, mainly by hospitalization, fluids, the medications which includes sedations, antihistamine, antiemetics, vitamins, and if necessary hydrocortisone. And we also seen the nursing management, and what are the diet which has to be followed. And finally, if nothing works out and you have to move on to a termination of pregnancy, how you can terminate the pregnancy before 8 weeks and after 8 weeks. I hope this content on hyperemesis gravidarum was informative for you. If you have any question based on this, you can just put it down in the comment section. Thank you.